Okay, here is a representation of the intracranial hemorrhages. We are going to talk about subarachnoid hemorrhage, which includes aneurysms, epidural hematomas, subdural hematomas, and also infarctions. What we're looking at is a subarachnoid. There's the arachnoid, is a spider. It often involves a rupture of a berry aneurysm. So the berry is right here. Patients often report the worst headache of their life. That's why he's holding his head, and you could put a little, headache symbol in here. Worst headache of my life. So you've got the berry holding his head. With berry aneurysm, it's associated with adult polycystic kidney disease, Marfan syndrome, and also Ehlers-Danlos. That's why there's kidneys on the berry, and they've got the spots on them. Rupture can lead to the subarachnoid hemorrhage, papilledema, cranial nerve 3 palsy, where the eye is down and out, and also ptosis. It occurs at bifurcations of the circle of Willis. So you've got the berry kicking Willis, and that's why that's what's involved with this berry aneurysm. Berry aneurysm. Over here is an epidural hematoma, and it's bleeding. It's bleeding from the middle see the middle meningeal artery, associated with fracture of the temporal bone. So you get a fracture going on here. It's characterized by a lucid interval. There's the moon, so lucid moon. Often over here we've got the subdural hematoma. Let's put subdural. And so you got the submarine, and it's bleeding from the bridges vein. So there's the bridge. It's characterized clinically by a gradual onset of symptoms, delayed onset. Let's put up here with epidural hematoma. Also, there's infarctions, and this can happen from thrombosis caused by atherosclerosis, and embolism caused by valvular vegetations and air bubble, tumor cells, or fat cells. Often, the most common site is the middle cerebral artery. So the MCA is the most prominent, and this comes from the internal carotid. The internal carotid comes up, it separates into the middle cerebral and the anterior cerebral. If you have a anterior cerebral artery infarction, you're going to have more lower body, because the anterior cerebral artery covers the very top part of the brain and the medial parts of each lobe. The middle cerebral artery is more the outside or lateral parts of each lobe. So it depends on which side. It's going to affect the opposite side of the body. And if it's the middle cerebral, it's going to be the head or the upper body. And if it's the anterior cerebral, it's going to be lower body. Now, the posterior cerebral artery comes off of the basilar artery, which comes off the vertebral artery. So at the pons, the basilar artery, it's named the basilar artery, then turns into the posterior cerebral artery. An occlusion or infarction of this area causes visual loss, dizziness, so keep those things in mind. These are all the intracranial hemorrhages and infarctions. It's often, associated with hypertension in many cases, or trauma. If you can keep all of these kind of, separate, you'll do pretty well.